Good afternoon and welcome to the
COVID-19
COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, NCDC molecular laboratories expand to 39, more in progress, even as country records more cases of COVID-19. As states enter community transmission phase of the pandemic, Niger State Task Force says it is at the forefront of ensuring compliance to the safety protocols. A Nigerian stranded in South Africa returned amidst flight restrictions over coronavirus pandemic. The Nigeria Center for Disease Control, NCDC, has recorded 649 new cases of COVID-19 yesterday night, spread across 22 states, including the Federal Capital Territory. From that number, Lagos has 250, Oyo 100, Plateau 40 cases, Delta 40, Abia 28, Kaduna 27, Ogun 22, Edo 20, Akwa Ibom 18, Kwara State 17, the FCT 17 as well. Enugu 14, Niger 13, same with Adamawa, Bayelsa 7, Osun and Bauchi 6 each, Anambra 4, Gombe 3, Sokoto 2, Imo 1, and Kano 1. Total confirmed cases now stand at 22,020, with 7,613 recoveries and the death toll put at 542. The total active cases in the country stands at 13,865 cases. So far, the top three states are still Lagos, the FCT, and Kano, and they are also leading in their respective regions. Nigeria is one of many countries around the world using the GeneXpert system to scale up testing capacity, and the NCDC is leading the expansion for COVID-19 in Nigeria. As part of the national strategy to scale up COVID-19 testing, the center says it is leveraging the GeneXpert equipment currently used for the diagnosis of tuberculosis to significantly scale up testing for COVID-19 and improve turnaround time for results in the country. According to the center, there are 400 sites in Nigeria with GeneXpert equipment. However, it is prioritizing the rollout of the machine in states where there is a high level of community transmission and states with limited or no laboratory capacity for the diagnosis of COVID-19. Nigeria now has 32 molecular laboratories in its network, while 2 are in progress. As at its last report, 120,108 samples have been tested across the country. The Enugu State government has been giving the latest update on the coronavirus disease management in the state. The Commissioner for Health, Dr. Obi Ikechukwu, says the number of COVID-19 cases on treatment are 138. The number discharged stands at 31. And sadly, the state has recorded 5 deaths. He also confirms that the new laboratory in the state, already operational, has confirmed 30 COVID-19 cases, putting the total laboratory confirmed cases in the state at 174. He's appealing for citizens to continue to maintain the COVID-19 safety protocols to keep themselves and others around them safe. For more what we're experiencing, which is the expansion of our testing capacity, we have joining us here in Lagos, Dr. Ante Ante. He's a general medical practitioner. We'd like to welcome you to the program.
Thank you very much.
All right. Good news that we're having more molecular laboratories being tested. We have the federal government say that 3 months, they hope to test 2 million Nigerians. We're looking at a little over 120,000. And this statement was made in April 28th, and we're getting into July. Do you think they can meet this target?
Well, there are many factors that would come into play, and if everyone plays their part, I believe they can actually do it, because tuberculosis is something that has been with us for a while. So if we're using the GeneXpert, which is kind of the same test that is done for the COVID-19, that's the PCR, polymerase chain reaction. So if we had already started with this before, I believe we would have gotten to our cutoff by now.
So as a general practitioner, when someone comes to the hospital now as before the pandemic, what will happen? Are things different?
Yes, things are definitely different because now it's every patient is presumed COVID-19 until proven of it otherwise. Hospitals are not willing to take the risk of taking in patients without actually knowing their status. So it now even makes a lot of misdiagnosis. So they'll probably like term someone COVID-19 when the person has some other disease, and you won't blame them because when the stigma comes that you have a COVID-19 patient in your facility, it actually takes away traffic from that facility.
So stigma both ways. Healthcare workers, stigma, patients, Nigerians coming to the hospitals, another stigma. How do we resolve all of this?
Well, the hospital is supposed to attend to all cases. But in this peculiar situation where we've not found ourselves in for probably even so long as my own life has been. So we don't really know exactly how to address it. So everybody's taking precaution to actually safeguard every other person, because a patient who comes in asymptomatic or comes in with mild symptoms might transmit it to a patient who, when he gets it, it might actually be full-blown. So we are trying not to have that kind of situation. That's why we have isolation centers. I believe like abroad, they are using their current facilities. So, and you can see how that has been. They just have like separate wards. But in Nigeria, we just try to isolate everybody and then wait the course of the disease or while trying to manage their other comorbidities in case they have any.
So if you have the high suspicion that a case might be COVID-19, what's the next thing?
It's to inform the NCDC and get the patient tested. The only thing is before the result comes out, and that's as a result of the number of tests that are being carried out. And our facilities, I don't know, I don't feel it can really match up based on our population. So people compare us with other African countries, but I think they need to look at the peculiarity of the population of Nigeria as a whole.
So in terms of the management and our peculiarities, like you've mentioned, how are we doing?
I would say, first I would say thank God, because we are not seeing it as bad as other countries are seeing it, especially like in the Western world. So people expected that Nigeria would be worse than it is today, but sadly we've lost about 542 people, but it's not compared to what we are seeing outside Nigeria. So I'd say the management, I'd say we are reacting to the disease differently and less hazardous as other nations are. So,
okay, I'd like to just ask one final question, and that is, would you say COVID-19 is similar to other diseases that we've had in the past?
Now, COVID-19 is still under the group of the common cold. However, prior to 2019, it wasn't common. So it's more like the flu, but it's more deadly because of what we've seen. It's more deadly. However, if you're looking at the death rate, it's not as high as some other diseases, not even as high as Ebola was. But because of the fact that nobody understands the disease, no one knows the progression, no one knows who is going to be worse when they come in contact with the disease, we can't actually say. But we all just have to like be on the lookout, and I believe we would have more information as time goes on and the disease abates.
All right, we'd like to appreciate your time, General Medical Practitioner, Dr. Ante. Thank you for joining us on the program.
Thank you very much.
Let's go over to Niger State, where the COVID-19 task force has been given an update on the efforts of the committee in ensuring the safety guidelines on COVID-19 are adhered to. According to the chairman, Mr. Ahmed Matane, and also secretary to the Niger State government, the government is doing all it can to prevent the spread of COVID-19 and safeguard the citizens of the state.
COVID-19, the status report is that as of today, Niger has 80 confirmed cases. It has risen from 66 that we had, to 80. Out of the 80, we have recorded 4 deaths as of today. We have only 2 at our treatment and isolation center. All the others, have actually been treated and they're fine, they won't go back home. However, Out of that number, 11 of them were actually Almajiris that we have collected, from different locations, in the state. 6 absconded, from the treatment and isolation centers. But by and large, this is where we are, 80 confirmed cases. So far at the isolation and treatment center, we only have 2. Most of those that have gone through the treatment have stabilized, and they turn out negative afterwards.
Well, a 5-year-old boy is among the newly confirmed positive cases of COVID-19 in Niger State. The official report released by the state's task force says 3 other children aged 8, 12 and 15 also confirmed positive. All 13 new cases are said to be from Chanchanga local government area. The new figure is the highest daily confirmed cases from the state since the outbreak of the pandemic. In Ekiti State, it's been mixed feelings as to the extent of the infection spread of COVID-19. Our correspondent reports that lockdown has been eased in the state, but not yet extended to religious centers as the state races to getting more people tested. Here's Babajide Agbeyo with more.
The fear of community spread of COVID-19 is gaining heights in Ekiti State, with some cases emanating with history not too clear. And the state government says we have to do more in managing the existing lockdown interstate movement and to also get the people more aware and sensitized.
Our community spread seems to be in our midst already, because not all our patients we can trace where they got the infection from. Why am I saying that? So everybody should take cognizance of the people around them. And I'll talk to our security again. Our borders has to still be closed. And for us that are within the state, people should endeavor to use their face mask. Face masks are not chin masks. They are not mask masks. They are not just nose masks. It is called face mask for a purpose.
The state government is also asking people not to express any fear as regards random testing for COVID-19.
We are going to start taking samples from the community. Please help us to tell the people it is not for any ulterior motive. It is to know the number of cases that are around in Ekiti State so Ekiti can plan adequately for its citizens.
The government and people of Ekiti State will have to ensure they don't relax in the war against COVID-19, even if the lockdown restrictions are relaxed. Babajide Agbeyo for COVID-19 update.
Still to come, we have more on community transmission of the virus when we return. Welcome back to the program. Now, Nigerians leaving South Africa, about 200 of them who had been stranded, now being evacuated the early hours of today. They could be seen entering buses, transporting them to the OR Tambo International Airport. Some of them say that they had been stuck in the country since it imposed its lockdown, and that's as far back as March. Let's welcome our guest right now. We have Dr. Okpeyemi Osunyomi, who is a public health physician. She joins us via Skype from Lagos. And here in our Lagos studio, Dr. Dupe Oyawale is a clinical pharmacist. She also joins us on the program. I'd like to welcome you both to the program.
Thank you. Thanks for having me.
Thank you.
All right, let's start with you, Dr. Osunyomi, and that is the issue of community transmission. We understand that it is rife in Lagos, but how bad do you think it is in other states of the country, seeing as we're seeing a varying, more like a zigzag spread of the virus on a daily basis in the country?
Good afternoon. Community transmission is increasing in Lagos, and I can tell you, I hope you can hear me. Hello?
Yes, go on.
Okay, it's increasing in Lagos, and I can assure you it's increasing in every other state of the country. A case of an example is Oyo State, which seemed to have been having low cases before, but in recent times, Oyo has become second in the number of people coming out positive for COVID-19. And it's the same thing in every other state. I think even states that may seem to have low values, it might just be because of the rate of testing being low and all that. But COVID-19 really is in the community. And I think part of the problem may have been the East lockdown. People are now more out, and seems caution has been thrown to the wind. Unlike during the lockdown and just immediately after the East lockdown, where we had quite a number of people wearing masks and all that, just like the former speaker, the immediate past speaker just spoke right now saying that is now not nose mask anymore, is now chin mask. That's what we see more now. But even now, it's even more of no mask, because I was out 2 days ago. I went somewhere and I think I was the only one, or maybe 2 or 3 other people where I was that had mask on. And I think that's the same thing we're having in every other state. So it's actually rising, and we're having it more in the community, and it's worrisome.
Dr. Oyawale, how close are we to some sort of solution, or even a better treatment regimen to really stopping, reducing the spread, and to cutting it off totally?
We are in it in the sense that we're doing everything possible, but the truth is that as long as people continue to flout the guidelines and regulations, it will look like it's a longer time to come for us to get to this point. And well, vaccines are beginning to come in. Like in South Africa, for example, which is another African country, they just, the vaccine that just came out, and they did this along with some other institutions like Oxford University. And they started testing actually last week. And we're hoping that as this goes on, we see more of these vaccines coming on. But the truth is that even WHO says that by the time we have a lot of vaccines out there, we'll need to start with the vulnerable people. So the best way to still go about this thing is for us to reduce the spread, flatten the curve, bring it down more by following all the guidelines.
And when you say starting with the vulnerable people, are we talking about communities in terms of...
No. When I talked about vulnerable people, what WHO wants is we're going to start with healthcare providers, and then vulnerable people like the pregnant people. We're also going to be vaccinating people with chronic diseases. They are at risk more. So it's when we figure out, then we can now start with the other groups. That's how the WHO wants it. But in South Africa, they're still doing the normal testing and then seeing how it works on a lot of people.
But what's your take on perhaps our track record of vaccine trials with other diseases we've had and we still have with us?
In Nigeria, yes, most times when vaccines just start, we usually, because most times we are not the ones that always get the vaccines and make the vaccines available. Most of the vaccines we have here, we bring them in, and numbers are usually not that much. And we always start with the vulnerables, just like some of the vaccines we had for the children, and they're still using them up to now, and it has really helped some of these childhood diseases. So we'll definitely get there. It's just that because we are not the one doing the trials, it might take a while for it to get to us, but the WHO will definitely make it go around as much as possible.
Let's come back to you, Dr. Osiomi, and that is looking at the daily cases. If we could take a look at, and that's if you remember, Kano State, for example, when they recorded their first case, what we saw, the unexplained deaths, the issue of is COVID-19 related, the state government saying it isn't, the different percentages. We've seen that from perhaps Friday, the 19th of June, till Sunday, there were increases in cases. Where they had about 12 on Friday, 2 on Saturday, 6 on Sunday, but then no case on Monday and Tuesday, and just Wednesday, we're seeing 1 case. Are we saying that they're doing better at containing the spread, or there's a lot of testing centers there in Kano right now? What would you ascribe to what we're seeing in the disparity in figures from the Kano?
Okay, for Kano, the issue might be the fact that just like it happened at the beginning, there was this confusion about was it COVID related, was it not COVID related, and then NCDC had to go to Kano, met with the state government and all that, and then okay, they tried to increase testing centers. But we knew the attitude of the Kano people right from the beginning. Majority of them never believed in COVID-19, and really that is, I think, is even becoming a national problem too, actually. So many people are disputing, even here in Lagos, that probably there's really nothing like COVID-19, that they're just being fooled. So the visit of the NCDC and all the shouts during that time may have made quite a number of people, especially in Kano City itself, the state capital, where you probably have more educated people, to have submitted themselves for tests, and with the fact that they created more test centers. But now, with increasing disbelief in the fact that the COVID thing might actually not be true, you are having not so many people going for tests. That's probably one. And then another thing, it could also be a problem from the test angle, from the laboratory, because so many of the laboratories too have problems with testing kits. So people when people want to go to do tests, they don't get to do it. And if they keep going back and forth and it's not available, they'll get fed up. So that also might explain why it might seem that there is low number of people people testing positive. Actually having low number of people going for tests. Either there are not enough test kits to go around, or the people just don't believe anymore that there's COVID-19, or everyone is just tired of the COVID-19 issue, and like someone said, we better start living with it. And people have like, well, we'll start living with it. So that might explain the Kano case, why we're having reduced.
Okay, thank you, Dr. Osiomi. But Dr. Ode, I'm sure we can be tired, but I'd like to know what you want to be seeing, what you'd like to see as the days go by, in terms of really reducing the numbers.
In reducing the numbers, we need to ramp up our testing. We need to do more testing. We're hoping that we can get some validated test kits that can be used by more people, and train more people to do the testing. Even pharmacists in America and some other places are already doing testing. So pharmacists will definitely love to be included in the testing when they are properly trained. But very importantly, we're going to be doing advocacy to drive people, let people know that they need to follow the guidelines more. Once we follow the guidelines as much as possible, the social distancing, the washing of hands, and every other use of face masks properly, like everybody has said, we'll definitely be able to do a little thing. We'll be able to reduce the spread.
All right, thank you. Thank you so much, Dr. Dugboyawale, clinical pharmacist. Thank you for joining us on the program. Also, thank you Dr. Kweyemi Osiomi. Thank you for your time. Well, New York, New Jersey, and Connecticut are imposing a 2-week quarantine on 8 U.S. states after a distressing surge of coronavirus cases in the South. The 8 states subject to the quarantine are Alabama, Arkansas, Arizona, Florida, North Carolina, South Carolina, Texas, and Utah. According to the count kept by Johns Hopkins University, the U.S. recorded a one-day total of over 34,000 new COVID-19 cases on Wednesday, the highest level since late April, when the number peaked at 36,400. According to the NCDC, a sudden loss of taste and smell with fever, headache, or runny nose may be COVID-19. Please do not ignore the symptoms. You're to call your state hotline immediately. Their website has regular updates on the COVID-19 regulations and guidelines. The World Health Organization, you'll find the coronavirus disease situation with the latest global numbers. It also has rolling updates on the pandemic, its strategies and plans as well. Our website, channelstv.com, has the latest news. All you need to do is log on to see news on the pandemic in Nigeria and across the world. That's the COVID-19 update. Thank you for watching. I'm Minister Walker. Bye for now.